been a really illuminating day for me, but even more than that, I am personally encouraged about the goodwill that's been shown in this room today about defending Medicare and working towards a more universal health system with a focus on extended primary care. You heard Brett say this morning that this union won't back down. Privatisation will undoubtedly lead us to an Americanised system.
Dismantling Medicare and cutting health budgets so that preventive health and hospital funding are compromised are, of course, only a piece of the puzzle.
Dr Con Costa then told us about Abbott's Plan C, the $6.15 copay.
They haven't been able to break Medicare by doing it. That's why they've got to bring the co-payment in. And let's be clear who they're doing it for. They're doing it for the private health insurance funds who are champing at the bit to come into primary health care.
You heard Tessa from ACOS tell us that access to health and education is a fundamental right.
It is about ensuring that everyone is able to access those services, irrespective of their income and irrespective of their means.
Julia told us that they won't be introducing any copay, and the flow-on effect of that, like so many other groups, is an effective cut to their ability to provide essential services.
NACHO would like to see a health system that meets the needs of Aboriginal people and creates incentives to have checkups, to see the doctor and to attend follow-up appointments.
Natalie O'Brien told us that for Get Up, Medicare is a hot button issue.
How can we play a role in lifting up health voices, elevating stories, elevating health professionals and distilling their messages in a way that was really, really easy for people to understand?
Jean Parker showed us a clip indicating to us that Medicare is sacred. It's the people's health system and it's not for sale.
You know, any co-payment, even if it's $1, is going to get rid of the model of bulk billing that we have. And once that's gone, the costs will continue to rise.
Lee Thomas then told us of the simple campaign message, Hands Off Medicare, and the need to work collectively.
We cannot give up. This has not gone away, and I don't think it will go away anytime soon. We have to stick together. I think that's why we're all here today. Campaign together. Our voices are much stronger together, and we need to use every avenue that we have.
Tim Senior told us that less than half of Australians have private health insurance. Individuals already significantly contribute to their health care through co-pays by the way of the gap between doctors' costs and rebates.
We're talking about equity, which is actually providing what people need rather than giving everyone the same. And I think that's crucial for healthcare.
We enjoyed robust discussion in working groups, plus when we were in our breaks, and it alerted us to the fact that this campaign is not getting to rural areas.
The co-payment has a potential to affect rural areas extraordinarily.
We need everyone to understand that we won't tolerate a safety net system and that the government needs to talk to a lot more people than the AMA. The people in this room understand the status quo and we don't like it. What I saw today was a consensus about what we have to do collectively. We do need to work together in the lead up to the next federal election, but even more importantly, we need to educate those we talk to. Universal access to quality public health system is a right, not a privilege, and neither capacity to pay nor your postcode should dictate the level of healthcare you receive.